Hey guys, since we didn't get to finish up, we only had that hour on Monday. No, on Tuesday. Dude, that was just yesterday. Sorry. Anyways, I went ahead and I'm making this little video for you guys so you feel a little bit more comfortable, hopefully, about physical assessment and what we're here to do. So I was going to do this cute little introduction, and what I wanted you to know is that the skills course and how it's broken down in the skills book is very step-by-step. And the reason for that is I want to equate it to like a peanut butter and jelly sandwich. Like if you were to try to make a peanut butter and jelly sandwich and you were not given specific instructions, or you followed somebody's exact instructions, it would be a little bit hard to do. There's this really cute little video that I included here where this guy is following the exact instructions, you know, his children give him. So if they don't instruct him to like open the peanut butter jar, he doesn't open the peanut butter jar. So it can be applied to skills in your skills book, because you may at times in your skills book need to use a little bit of common sense about what hand you should use or how to do it. And the only way to get good at making a peanut butter and jelly sandwich, if you've never ever made one before, is to do it over and over and over and over again. And so I want you to think back to anything that you do on a regular basis that at one point you had to learn how to do. And the only way that you get better at this is by thinking about it, doing more research, and practicing. Practice, 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 practice. And that's the only way you're going to get comfortable in these skills course. So please do yourself the favor of really investing in yourself during this course. So we reviewed the syllabus and we answered some of these questions, and go through and answer those if you're not sure. So let's talk a little bit about physical assessment. What's the point of physical assessment? Well, this is the first stage of the nursing process. The nursing process, we do assessment, we do diagnosis or analysis. We make a plan for what we're going to do for the patient. We implement the plan, and then we examine and evaluate and look and see if our plan was successful. And it's all about helping people feel better. Really, as nurses, that's what we are trying to do. But we have to have some kind of process or framework by which to work by. The other purpose of physical assessment, it helps us gather subjective and objective data. So subjective data is going to be like things that the patient tells you about their pain level or how they're feeling today. Objective data is going to be things that you hear and things that you see on the patient. If the patient has a gaping wound, the patient has a gaping wound. That's subjective data. And it's also important for us to do physical assessment correctly so that our results can be mimicked or repeated and everybody can get the same results. So if we're hearing a certain kind of lung sound, everyone should be able to hear those lung sounds. It also provides us with a baseline of how the patient was doing. So in order to figure out how somebody is feeling, if you do not know someone very well and you walk in and you see them sitting there, you're not going to know if they look paler than normal or if they look happier than normal or sadder than normal, because you don't know this person yet. But you have to establish a baseline. So then the next time you see them, you can go, oh, they look paler than they did yesterday, or they look happier than they did yesterday. And that's kind of the same thing here with our patients. We need to establish some kind of baseline as far as what does this patient look like, so we can know if the patient gets better or worse throughout our shift. So when should we do this? Well, beginning of every shift, ASAP. So when you guys are in clinical for the rest of the semester, not this Thursday, but after you get checked off on physical assessment, you should be, as soon as possible, getting in there and performing your assessment. There's a little bit you got to do before you do it. You get in there, and we'll talk about that in the next slide. But you need to get in and assess your patients as soon as possible. Know what they were like when you took over care of them. We should also be assessing our patient anytime they have a change in condition or a symptom is there that wasn't there before, or maybe it went away. We need to assess and reassess and reassess and reassess our patients. And how often should we do it? Maybe also be based on acuity. The more sick a person is in the ICU, for example, we not only perform assessments more frequently, but we also chart them more frequently. So when you're preparing to go in and assess your patients, it's good to gather background data and to do a couple really important things. So first of all, you want to make sure that you know which patient you're going to see and why you're going to see them. What are they here for? And that'll also help guide you. For example, if there are common associated symptoms with that exemplar, and then you're going to see this patient, and that's the reason for their admission, you should be looking for those symptoms. So this will help you determine what symptoms am I looking for, expecting to see on this patient. Looking at past medical history can let you know a little bit about what medications to expect them to be on. That's the EMR, the Electronic Medical Administration Record here. what you expect to see on that EMR, what you expect to see on the patient. If they've had an open heart surgery, you're expecting to see a midline scar down the center of their sternum. So those are things to think about. Also, I personally, if I have time, I really like to look up the physician orders before I go in, because I want to know what I can expect to be sticking out of this patient or attached to them. I want to know, is the patient on telemetry? Then I need to look for the telemetry box. And if it's not there, I need to get it on there if it's ordered. So that's really helpful. At least look up your patient's room number, their name, their date of birth, look up why they're here. If you have time, look up their past medical history and their EMR before you even go in, and look up what's supposed to be ordered. If you don't have time for this, maybe start getting there a little bit early. When I worked on the medical surgical floor, I would arrive on the floor at least 20 minutes early. And these were 20 minutes I didn't get paid for, but I did it so that I could start my day off right away going in and seeing my patients. And it just made for a much better day for me, personally. So we look at the chart and we look at what we can expect when we go in the room. And then we want to obtain a report from the outgoing shift. So we've already made some assumptions about the patient, about some symptoms we might see, or anticipated. I wouldn't say assumed, but we can anticipate a couple things. So the next thing we want to do is get our report from the outgoing shift. And this is where it's really helpful to have that background information. So if they're telling you that the patient, for example, has a DVT, has deep vein thrombosis, and they're not on some kind of anticoagulant therapy, you can ask and you can go, hey, I noticed they're not on Lovenox, or they're not on heparin. Is there a reason they're not on that? Or maybe the patient has activity level and it's up as tolerated. Why is this patient with a blood clot in their leg up walking around? So this is where it's helpful to look up those kind of orders, so that when you're obtaining a report from the outgoing shift, you can kind of catch things that maybe don't make sense, or ask, hey, has this been done, or this order's been done? So it's very helpful to look up everything beforehand so you can be really engaged when you're obtaining report. The other thing is, be confident about what you're there to do. You are there to assess your patient, to look them over, and to gather this baseline data. You cannot delay doing this. So get your confidence up, pretend that you're already a graduate nurse or whatever. You're basically preparing to be, you're training to be now the kind of nurse that you're going to be when you graduate. So already be thinking about that and the kind of nurse that you want to be. So get your confidence up. You can do this. I have 100% faith in you. All of us started somewhere, so we can do this. Make sure that you have your supplies. For just this basic head to toe assessment, you should always have with you your stethoscope and your pen light. There are some areas of nursing where you don't always have to have this on you, but if you are on the floor or you are in any of these acute care areas in the hospital, OB, ICU, ER, or medical surgical, you always need to have your stethoscope on you, and you need to have a working pen light. Always. So have those supplies with you, and that'll make you feel a lot more comfortable and prepared. So we're all prepared. So what do? Let's get our butts in there. So let's go in and we perform AIDIT. We always start with our AIDIT. So we're going to go ahead and acknowledge the patient and say, hello, good morning. We're going to introduce ourselves. We're going to tell them how long we're going to be there. I'm going to be here till noon today. However long are you going to be there? Explain the reason that you walked in the room just now. What are you going to do to that? Right this moment. And then you can wait the tea until afterwards when you're all done. As you're walking in, look around. This is general survey, looking around and establishing a report. You're looking, where is the patient? Are they, in this picture, they're laying in bed and they're kind of curled up in a fetal position. Maybe that's the way she sleeps, or maybe she's having some pain. So right off the bat, I'm noticing that. I'm noticing she's in bed, she's curled up, maybe sleeping. I'm noticing that there's an IV pull here. I'm noticing that something may or may not, look at that thin little line that's going to her somewhere. There's maybe the call light. Is that under her? Is that under her back? I'm not exactly sure. I need to check on that. And I see that this patient's skin looks pretty normal. It's not too pale, or it's not gray, blue, discolored, or anything like that. I don't see any oxygen attached or any kind of other medical devices. So that's what I can observe as I'm walking into the room. I also see there's a bedside commode over here. I see that for some reason there's a towel draped over the trash can. Don't know why that's there. And that the bedside table is way far away from the patient. Well, those are all things that you can gather and look at as you walk in the room. And make sure that you are exuding confidence, kindness, and compassion and caring. Let them know that you're there to care for them. That's what you want to do. Explain what you're there to do. And you can do several of these things at once. So as you're walking in and you're doing your AIDIT and you're starting to do a survey and you're looking around the room, making a quick check around the room, and you're also making eye contact with the patient, and you can go over and wash your hands and explain what you're there to do. I would advise washing your hands with soap and water because before every assessment, because it's kind of like a nice in between. You know, you've been going in and out and doing washing in and washing out with the foam, but let's get that foam off and make sure that before each patient, let's just make it a habit to wash our hands. It's a good habit to have. So we're going to tell the patient what we're there to do. This is an example that you would say, I would like to go ahead and ask you a few questions about how you're doing. I want to take your vital signs and take a quick listen to your heart and lungs and just give you a quick look over. I would recommend, especially your first assessment of the day, start it by doing your vital signs. Okay, so that's just a note. So wash your hands. Make sure your supplies are clean between each patient. I personally carry some alcohol swabs in my scrub pocket, so I can just pull those out after I wash my hands and as I'm speaking to the patient and having a conversation, asking these questions about privacy, about family members. I'm wiping off my stethoscope and my pen light so they can know that I'm cleaning things and that also I'm respecting their personal space and I'm staying off to the side, so I'm not right on top of them while I'm doing all of this. So once we've provided privacy and everything, we're going to go ahead and start our assessment. So we've already started it in some ways. We've done a nursing history. We checked the chart. We're using observation. We're looking, we're listening, we're smelling, we're looking around here, and we're starting this interview process with the patient using therapeutic communication and caring body language. And then we're going to do this physical examination. You may be familiar with some of these words already, but physical assessment techniques include inspection, just looking, palpation, actually physically putting our hands on, percussion. It's very hard to do this with gloves on and it's very hard to do it over clothes, so I would advise not doing that. And then auscultation. Auscultation is to hear internal sounds inside the body. So as we go through our physical assessment from head to toe, this is an example of some of the concepts that we're looking at, and then down below I have more or less the body systems that we're going through as we go through here. So as you can see, what I want you to see is that even when you're working in a head-to-toe manner, you're assessing several different systems at once as you work down the body. If we tried to do one system at a time, we would be up and down and up and down. So we'd be, like if we're assessing neuro, so we'd be at the head and then we'd be doing hand grasp, and then we'd be down at the feet. So you really have to use some flexible thinking here to assess your patient from head to toe, but also realize that you're assessing several different systems all at once. So you can thank me later, but your instructors over here, we made a little video for you just demonstrating just the checklist. So you hopefully will feel a little bit more comfortable practicing and doing this on Monday for your checkoffs. Watch this video, copy and paste the link, and you can watch us do a head-to-toe assessment. And look for the things that we did wrong. Not everything is perfect, so look for that in that. This is a really long video, but this is a very thorough head-to-toe assessment. I love Sarah RN, registered nurse. Her videos are awesome. But really take a look at this head-to-toe checklist because that's what you're going to be checked off on Monday. And then just for your information down below here, I do have how to assess an apical pulse. You can follow these links on how to assess the lungs. Here are some, you can hear abnormal lung sounds and abnormal heart sounds and regular lung sounds. So go ahead and listen to those. You're not going to be perfect. You're not going to be able to imitate all these things, but at least it will help you know where to place your stethoscope on the patient and begin to gather data. The last step in assessment is always going to be charting our assessment. I don't have that on here, and but this is something we're going to be working on through the semester is, okay, we gather this data, we perform the physical assessment, now you have to chart it, you have to document both your subjective and objective data. So that's something that your clinical instructors need to work on you with in clinical. And then the more that you do this physical assessment from head to toe, the more comfortable you're going to be with it. So go ahead and we're just starting with the basics. We're starting with a very basic head to toe assessment. Follow the checklist, watch this video, and let me know if you have any questions. And yes, you need to do 2 peer checkoffs before we check you off on Monday. and you can ask your instructors to come into the lab or get together with your buddies, your nursing school buddies here, and have them check you off and do your peer checkups. Hope that helps.